Hello, BDO family, and thank you for joining us once again on the Black Doctor platform. My name is Jade Curtis. I am the executive editor of blackdoctor.org, more affectionately known as BDO, and your moderator for this evening. I want to welcome everyone to today's important and empowering conversation on cervical cancer and HPV. So for those of you who don't know, January is actually cervical cancer awareness month, and we are here to shed light on a topic that actually impacts millions and is often misunderstood or overlooked. Cervical cancer is one of the most preventable and treatable forms of cancer when detected early, and yet it still continues to disproportionately affect Black women. So today, we're going to discuss what cervical cancer is, the critical role of HPV in its development, and the steps that we can take to protect ourselves and our loved ones. And so that can consist of, screenings and vaccinations to breaking down the barriers and stigmas within our community. So if you are joining us this evening, please leave a comment in the chat and let us know where you are joining us from. Share this with your friends and, maybe grab a notebook and a pen and paper because we're going to learn a lot and, you should really take in all this information. So with that being said, I am happy to go ahead and introduce our esteemed panelists, starting with Dr. Amy Weiser. Hi, Dr. Amy, how are you?
I'm doing great. Thanks for having me today. I'm really excited to join. Would you like to for me to give a little vignette about myself?
Yes, sure. Tell us all about you.
Excellent. So my name's Amy Weiser. I use she, her pronouns, and I'm a family physician in Portland, Oregon. I've worked in the underserved rural community, and currently I work in the urban underserved community, primarily focusing on the LGBTQ community as well, practicing HIV medicine. And I'm a huge proponent and supporter of early HPV vaccination as well as appropriate cervical cancer screening.
Wonderful. We are so happy to have you. I'm so excited to have this conversation with you, a part of it. Next that we will be bringing in is Dr. Susan Vataparampil. Hi, Dr. Susan. How are you? Oh, looks like you're on mute.
That has to happen at least once, right? So thank you so much for having me. You said my name beautifully, always a great start. My name is Susan Vataparampil, and I am the Associate Center Director for Community Outreach and Engagement at Moffitt and also a researcher. I serve as co-chair of the American Cancer Society National Roundtable on Cervical Cancer, of which Dr. Weiser is also a member. And my personal research over the last 2 decades has been focused on how do we get these amazing advances in vaccination, screening, and treatment into the arms and lives of folks that are most likely to benefit from it. And so I've always had a strong focus on providers and what we can do to support them, and also health equity, that is, which communities are getting left behind. Thanks for having me.
Of course, and thank you for all of the work that you do. We're so happy to have you. Next, we are going to bring in Dr. Ashonda St. John.
Hi, everyone. My name is Ashonda St. John. I am a board-certified OBGYN for over 26 years. I'm the chair of the OBGYN department at Health Alliance Hospital. I'm also an associate professor of obstetrics and gynecology at New York Medical College. After working 20 years in the inner city in New York City, I departed and came upstate New York, which is more of a rural population, for the past 5 years. And so I was trained at the Sophie Davis School of Biomedical Education, which is geared towards producing minority physicians to work in primary care in medically underserved areas. So that has always been my North Star, is to serve the underserved and marginalized communities. And when we see that there are diseases that are preventable, right, and there's prevention, I think that's where I have become the most of a vocal advocate. And I would say this, moving into rural spaces, I have diagnosed more cervical cancer than I ever have in the inner city in New York City. And so this is really close and dear to me. And so I'm just happy to be part of this discussion with this esteemed panel. So thank you.
Absolutely. Thank you for joining us. And lastly, we bring in, last but not least, of course, Dr. Jennifer Irves.
Good evening. Again, I'm Jennifer Irves. I'm very excited to be here today. I am an associate professor slash behavioral scientist. I'm also the director of community engaged research here at Vanderbilt University Medical Center. Particularly, and I cannot leave out the National HPV Roundtable. I'm also the task lead for the HPV vaccine equity arm of that roundtable. Particularly in my day to day, I work to do research to identify strategies to build confidence in HPV vaccination. As the panel has already stated, we know that HPV cancers are very much preventable, and I engage in research where I identify strategies to build confidence. Thank you again.
Of course. Ladies, I am so happy to have you. We've got some busy women on this panel, but doing the work that needs to be done. So again, I thank you all for joining us, and thank you all for the work that you are doing. So I'd love for us to have a very free-flowing conversation. Of course, we're going to ask the questions, but if you hear something that you kind of want to chime in on, or you have additional thoughts, please feel free to do so. Sound good?
Yes.
Wonderful. So let's go ahead and dive in. First question, can one of you briefly explain what cervical cancer is and how it develops in the body? Does anyone want to jump in on this one first? I'm going to call you out in a second.
Well, I'm happy to, as a gynecologist. Cervical cancer is a malignant tumor that happens at the bottom of the womb. So if we think of the uterus, right, where you would have a baby, right, the cervix is the bottom of the womb, and that's why we really, recommend Pap smear testing, because that is a screening for cervical cancer. And so what happens is with cervical cancer is that sometimes you may not have any symptoms at all. Sometimes you may have irregular periods or bleeding in between your periods or bleeding with coitus. And so these are kind of the things that we want you to present to us and come to your doctors or your providers, your family medicine doctors, your midwives, your nurse practitioners, to talk about, right? Because we know when something is unusual, but sometimes we don't know and we don't have any warning signs at all. And that is kind of really the onus of prevention, but also with screening, because those are strategies that we can prevent things that you don't need to even encounter in your life.
Absolutely. And so you mentioned that it shows no symptoms. So I guess, what am I trying to ask? If there are no symptoms, how do you track? How do you know? How do you know? How do you know? What can you do to protect yourself or those you're around? What do you do if there are no symptoms?
Well, this is the importance of having your routine gynecological examination. And so this is kind of the proponent of having the annual exam. So we understand, and I think we're going to get into kind of the guidelines in terms of Pap smear screening and kind of how we schedule that and how often you should have it. But in addition to that, we want you to have routine visits with your provider, because sometimes there are symptoms, but sometimes there aren't. And so when you have that routine guideline or that routine physical exam, you're able to identify things that you may not. And so we want to be mindful of that, because often the biggest thing that I get is patients had a baby 20 years ago and everything has been fine, so they haven't been to the doctor. And so, or they will miss those warning signs or anything, or those red flags, because they thought it was nothing, right? It could have been stress. I lifted something heavy. We also provide a lot of reasonings for things that may not be right, but we know our bodies, right? And so what we get you to the office, often I have patients say to me, you're going to kill me. I haven't been to the GYN in 10 years. And I say, no, because you're here today. So we're not thinking about yesterday, you're here today. And that takes a lot of bravery, because coming to that exam, that's the most invasive, not so personal. There's no other office where you have to completely get disrobed and see your provider. So again, we have to give our patients their accolades for making it in the door, and then making sure that they're treated with such respect and humility that they will return as well.
Absolutely. Thank you for that response. And so we also know that our conversation is about HPV. So what role does HPV play in the development of cervical cancer, and why is early detection crucial? Dr. Amy, can you tackle that one?
I would love to. So cervical cancer really, as far as the etiology or how this occurs is it's really related to HPV. And HPV is a very common sexually transmitted infection. We think about HPV a little bit differently than we would say maybe gonorrhea or chlamydia because HPV in and of itself doesn't have any signs or symptoms. And it's hard to track as to where you may have gotten it from or how long you may have had it. But HPV is definitely a causal factor, though not the only necessary factor, in the development of precancerous changes. And if not found and diagnosed and treated, it will turn into cervical cancer. One of the great things is that we have the secondary prevention of cancer, which are cervical cancer screening. So primary prevention, HPV vaccination, secondary prevention, cervical cancer screening. And really, it is, I think, the only cancer where we have several layers of prevention that are easy to come by, that are mainstream in medical settings, and really can be life-saving and life-changing.
Absolutely. And so you mentioned some of the screenings. What are those recommended screening guidelines or for cervical cancer? And then at what age should you start thinking about it for your daughter, or is that something that you do more as an adult, Dr. Susan?
Yeah, sure. I'll start, and then please, anyone else, jump in sort of from your perspective or your practice. So there are different organizations have different guidelines. So I'll try to kind of hit the highlights of sort of what the general recommendation is. One of the biggest organizations in the U.S. that provides guidelines is what's called the U.S. Preventive Services Task Force. And so those are folks that bring together experts to help look at the data, the science of what we know, to talk about what makes the most sense for the population overall. And as Dr. Ashanda mentioned, the population overall is overall, but there may be individual circumstances. And so I want to kind of balance, that information as well. So the U.S. Preventive Services Task Force recommends cervical cancer screening every 3 years with what's called cervical cytology alone for women ages 21 to 29. And then for those that are ages 30 to 65, there's kind of a different series of options. And here's where really having that relationship with your provider and having those discussions is really important for what do they feel most comfortable with? What do you feel most comfortable with? But some of the options are screening every 3 years with what's called cervical cytology alone, or every 5 years with human papillomavirus testing alone. Cervical cancer and other HPV related cancers are unique in that we actually know, like, what is the thing that is causing the cancer. In many other circumstances, that isn't the case, and we can't test for one specific thing. Or every 5 years, what's called co-testing. So doing both the cytology as well as the HPV test. And again, kind of having those conversations with your healthcare provider, the guidelines that they may follow, which might slightly differ, but the general gist is the same.
Can I just jump in there? Just so one of the things that kind of is confusing, right, is that for many years, our guidelines were once you became sexually active, that's when you need your pap test. And so one of the things that we understand is that, along with the guidelines that were just stated, I kind of work under the body of the American College of Obstetrics and Gynecology. And so we do recommend your first pap test at 21 years old. Now, that doesn't mean that that has to be the first time you see a gynecologist or have your pelvic exam, right? So if you are sexually active, you can see a doctor and be examined. But I also utilize that opportunity not to do a pap test, but also to counsel my patients on HPV vaccination. I want to check and see if they've been vaccinated, because we understand that that is recommended at the age of 11 and sometimes the age of 9, right? And so sometimes people get missed, or there's ideas, or, they did not have the consent of the parents to have that done. So I always say if a patient is sexually active, they should be visiting their gynecologist or their family medicine doctor or their nurse practitioner, right? And to have those first formative conversations, but also give them the structure. So we're going to say at 21, we're going to start those pap tests, right? And then I always explain to them that, we do that every 3 years until you're 29. Right. And then from 30 to 65, we can either do it every 5 years when we do the pap test with the co-testing, or there are some offices that don't offer co-testing, and that's okay. Then we just repeat it every 3 years. And like was said before, after 65, there are certain criteria, and it could be someone is HIV positive, they may have a history of breast cancer, different recommendations that would then have them have more frequent surveillance. And so I do advocate having those conversations, getting the knowledge, getting the information, because information is power, and we know that health is wealth. So even if you're not ready for the pap test, let's get you in and start having those conversations.
Mm-hmm. Mm-hmm. Absolutely. I love that you brought up the HPV vaccination, because I know it's kind of a controversial vaccine, considering it's related to sex, and the age that we're talking about getting it is a little bit, it's young, to be completely honest, in the topic of sex. So for those parents who are kind of on the fence about it, I guess, what would you say? What kind of conversations do you have with the parents or the person who is sexually active and maybe came in the office without their parent? How does that conversation usually look?
I think Dr. Amy should answer this question, because as a gynecologist, I don't typically see pediatric patients, but also in New York State, once someone is sexually active, they're an emancipated minor, so they don't require parental consent for care. So I'll let Dr. Amy take the floor.
That's so kind of you. Yeah. Anything related to sexual and reproductive health does have this stigma, this taboo associated with it. I think that, or I would like to think that as we progress in generation, that we're more open in talking about these topics and more aware. Listening to the conversation that Susan and Dr. Shonda had, things are confusing and they change over time. And it's important to know that, what maybe was recommended when I was a teen or in my early 20s is not recommended now. And so I like to use that as a starting point for any conversations, right? For parents who bring in their children for routine child visits, vaccinations, they probably are not going to know about the HPV vaccination because it wasn't something that was there when they were that age. Mm-hmm. And level setting this conversation, talking about HPV vaccination, that this is not the green light for sexual activity, although please do talk to your children about that. And I'm happy to do counseling as well. This is a cancer prevention vaccination. And I think that presenting it that way is true and accurate, but it can help to alleviate some of the taboo, stigma associated topics surrounding the vaccination. If anyone comes in between the ages of 9 and up to 45, this is a discussion to have. Absolutely, having it at a younger age, starting age 9, before sexual activity, helps to prevent the infection of HPV, because HPV, as I mentioned, is an STI. But you know what? All of us have probably had at least one strain of it if we've ever been sexually active. And so thinking about it in those terms, really focusing on cancer prevention, can really forward a conversation and have some folks who maybe are turning their ears off to this because they don't want to think about their kids being sexually active, really have them listen in a different way.
Mm-hmm. And I don't know if it's particularly reassuring or not when you're in the context of talking to parents, but we've actually done studies about whether vaccinating against HPV changes child's behavior, if you will, or initiate sexual activity at an earlier age, or they somehow got that message of green light, and we just have not found that to be the case. And so I think obviously it's reassuring to the healthcare providers that are having these conversations, but sort of rest assured, and I'm sure Dr. Jennifer, in your work, this is probably part of the messaging that you think about.
Absolutely. Dr. Amy, I kind of want to zoom in on something that you just said about how you said probably all of us have had a strain of HPV. And I know we were talking about the younger age, but okay. So obviously very easy to get HPV. First of all, how common is this really? And then even if you are taking preventative steps, is that if you're wearing a condom, can you still get HPV? Because if you're sexually active and you're taking the precautions to protect yourself, can you still, if it's that common? I don't know. What do you think?
There have been different studies, and this may be hard to qualify or quantify, but about 80 million people at any time are infected with HPV. Now, HPV, there's over 400 types. We usually think about 12 types that are high-risk HPV, and those are the types that we test for, because those are the ones that if they stick around long enough and those infections persist and progress, they are the ones that can cause precancerous and cancerous changes of the cervix, as well as other genitourinary areas and the oropharynx, so the throat as well. HPV can be prevented to an extent if during sex you use condoms or barriers, but really the protection rate is about 70 to 80%. And so even if you're doing due diligence to try to prevent against STIs, it's not an absolute. Other things that can be helpful are not smoking and drinking minimal alcohol. Those have also been shown to be risk factors in the persistence and then further development of HPV-related cancers.
Interesting. Was someone going to chime in? I'm sorry.
I just wanted to say one other thing. When we talk about vaccination, I want to make sure that it's completely clear that this is not only for women. This is a vaccination for both men and women. And so we really encourage this vaccination, again, ideally before they start their sexual intercourse activity. But again, it's something that we propose at the age of 9 to 11 for their first doses, but it's both for boys and girls.
Interesting. And I know at the top of the show, I mentioned that it's disproportionately affecting Black women, but obviously Black men can also get, all human beings can get HPV. So if a man is getting HPV, is there a way that they can get tested for HPV? Do they have a way of knowing? Do they show symptoms?
There's not a standard set of guidelines or recommendations for men when it comes to testing for HPV infection. So all the more reason that you would want to vaccinate our young men as well. So again, as Dr. Ashanda mentioned, starting as young as age 9 is within the recommended sort of age group. It's a perfect opportunity to not have to think about that risk as a result, or think about it much less.
Absolutely. Interesting. Okay. So for those who maybe have not gotten,
Dr. Amy wanted to chime in.
I was just going to clarify one thing. There is a participant from Harvey, Louisiana, hey out there, who said, "Is this the Gardasil shot?" Yeah, that's what we're talking about. The HPV shot is Gardasil. So you're already on it. You got the info.
Nice. Yes. Anyone else in the chat who has any questions, please chime in. We would love to answer your questions throughout the broadcast. I need to switch my back end over to the comments so I can see those coming in. But thank you, Dr. Amy, for addressing that.
And Jade, may I add one more thing about, we've been talking about vaccinating early for a variety of reasons, but one that may appeal to parents and to kids is that if you vaccinate before the age of 15, you only need 2 doses of the HPV vaccine versus 3 doses if you're vaccinating at later ages. So everybody would take one less shot in the arm if they can swing it. So
nice. And so is the HPV? Oh, sorry. Go ahead, Dr. Ashanda.
No, I was just gonna, on a personal note, I remember, and this is over 26 years ago, 28 years ago, when I was in medical school, they were still coming up with this vaccine. And I was just like, why can't they figure it out now? I want it now. I never want to have cervical cancer. And I'm going to tell you, when it finally came out, it was only for people stopping at the age of 26. And I had was I just 26? I might have been a little older, but I really wanted this vaccination because I understood how this is a game changer, right? How do you eradicate your possibility of getting cervical cancer? One of the the bedrocks of what we do as gynecologists is we do pap tests, right? Because Dr. Papanikolaou came out with this screening for cervical cancer. We do not always have screenings for every cancer. I can name several gynecologic cancers, such as ovarian cancer, where we don't have screening. And so for us to have this opportunity, not only to have a screening test, but have a preventative measure in terms of vaccine. I was enormously happy when the FDA approved the Gardasil vaccine to be extended to the age of 45. And so I do have these conversations with a lot of my midlife patients who, again, they're past the time when they could have got it when they were young because it didn't exist, but they're still under the age of 45 and they still can get it. And so we understand that, with these different dating applications with Hinge and Tinder and all those things, our patients are sexually active, right? And so how can we help them not only protect themselves against a future cancer, right? But we can essentially save their lives. And, like I said, and someone who has been practicing as long as I have, and if I told you the amount of people, I have not diagnosed many cervical cancers because, again, we don't see it that often in this country because of the screening, because of the preventative measure. But what we're seeing is that we have healthcare deserts throughout the country. And so people are not having the access and the availability to see or seek out their needs for their women's health needs or gynecological exams or their pap screening. And so I am passionate about this because when I first moved upstate New York, I had this young Black woman, 41 years old, hadn't had a pap since her last baby was born, and that was 15 years prior. And I knew immediately when I did the test that it was going to be abnormal. And by the time we got her to come in and we did the biopsies to confirm, she had metastatic cervical cancer and she did not survive more than 8 months. And she was only 41 years old. So I say this because I see it. And, I think that when we think of prevention and we think about screening, it should hit us all close to home because we want all of our loved ones to be healthy.
Absolutely. And, that was going to lead into my next question. While we've talked a lot about prevention, and some people do receive, a positive diagnosis for HPV or cervical screening results. So even though we've heard that unfortunate story just now, what are those next steps in care? What does follow-up look like from there? Dr. Jen, do you want to jump in? Dr. Jennifer, excuse me.
Well, yes. Yes, I'm here. I'm primarily HPV vaccine confidence. But yes, when you think about next steps, you have an abnormal test. We know people sometimes can be fearful. What does that mean? But talk with your doctor. Typically, they may do a colposcopy to see where we are with abnormality. Also, they'll do a biopsy to see where you are in terms of stage, how do you fare when it comes to diagnosis? And then you'll just talk with your doctor after you get your results to determine what the next steps are. And once you do that, literally, I've heard individuals who have gone through this process, it may be scary, but once they know, they're able to talk with their doctor, they're more comfortable to have those conversations. And sometimes, in thinking about that with fear that we hear a lot of, sometimes it may not be as bad as we may think it may be when we actually go through this process. But when you detect early, then you can get better outcomes. And we know that that's why those yearly, now 3-year exams or 5 years, if you do the HPV test, is so critical so that early detection, you can have the best outcome.
Absolutely. And so for those who I heard about a syndrome called white coat syndrome. And it's this fear that, you go to the doctor's office and you hear bad news, and it can actually affect kind of your numbers, right? That can affect your, oh my gosh, the word is slipping my mind. But
like your blood
There we go.
pressure.
When they put the blow up thing on your arm, you know what I'm talking about. And so I think this kind of relates to those who, if you hear that you have abnormal cells, it can kind of make people want to run away and say, okay, I don't want to hear anything else. So what are some of those risks of delaying care? Like, why is it important to make sure you go to those follow-up appointments and not delay your care?
I mean, in a very simple way, and please add, getting rid of those abnormal cells is possible and doable, which means then you don't get cancer. And so of course, it's never, people may not feel like, oh, it's great news that I found abnormal cells, but it is great news because that's a point at which we can do something that may help you down the road. But with any cancer, whether it's cervical cancer or any others, if there's an opportunity to nip it in the bud, so to speak, it really makes a difference in terms of your treatment options, the toll that it takes on you and your body. And so, from a passion perspective, this is one of mine of, how do we make sure, reassure, navigate, support women so that they understand, the potential of timing being so critical. And, I love to think that our healthcare professionals, people go into it for the right reason, which is where they wanted to help people. And so that's what they're there for. Don't be scared. I wish, Amy and Ashonda were close by. I would go to them. We have a lot of wonderful healthcare professionals.
Yeah. I think I'm just going to chime in. I think that it's extremely difficult ever to hear that something is abnormal. And I think now we have My Chart, we can get the results on our phone. And so what happens is sometimes the patients have the results before they talk to us. And guess what? The scariest thing in the world is find out that you're not normal. All right. And so then having, and this is why I always say, and I always start with, you were brave to be here. Because it's not easy. So white coat hypertension is very true. I do not even wear white coat in my office. Now I do have embroidered scrubs because no one ever thinks I'm the doctor, but that's a whole nother discussion. But I do not wear white coat specifically because of that. And I think that when we kind of understand, like, there's so many dynamics happening. And again, My Chart was a great thing, but it's a scary thing. And so what I try to do is break down what are the next steps, what can we do? Often I see patients who had an abnormal result and then just disappeared. I didn't like how the doctor spoke to me. I was scared. I don't think they were going to be kind. Or we have to kind of also talk about social determinants of health, right? Their insurance may not have covered it. There was a copay. Or if they're in deserts, I could not find a doctor who does colposcopy. And colposcopy, and we kind of briefly talked about it, but that is just using a microscope to take a look at the cervix and then possibly biopsying areas that look abnormal through the microscope. So this is something you may not be able to see with the normal eye, but a microscope would enhance it. And so there are so many dynamics at play. And so kind of understanding that, have an appreciation for that. And again, I am so thankful when my patients come, because if I had all those things against me, I don't know if I would show up as well, right? And so understanding that there are different treatments, I love the day when I say, oh, there's nothing to do, we'll just see you in a year. Those are the best things, right? And patients love that because they have peace of mind. But again, we always fear the unknown. And if we don't know, we don't know. And so we have to always think and put ourselves in our patients' shoes. And that's the way I look at it, because if I didn't know something, I would be scared as well. So kind of walking our patients through those steps, that is the one that takes care, tender loving care, and we want to be delicate because these are delicate matters. Having these exams are not comfortable. I can tell you when I first moved upstate and I started my first day of seeing patients, they didn't have a small speculum. And I was like, well, no. I only use small speculums because I get these things done too. Unpleasant. And so they said, well, we'll order some, but in the meantime, these are the ones we have. I said, oh no, call another office. Let's get them, because that's when I'll start seeing patients, when we have those. Because again, we have to be an advocate for our patients as well. And I think when you go into the next thing that's complex is when I see patients that are trans. Think about that. That is extremely delicate to be coming into a gynecologic office. I have patients where I can't write them a doctor's note because the people where they work will know that they saw a gynecologist, but they may be a trans male, right? So we want to be very, very sensitive and intentional when we think about what our patients go through, because there is a whole host of things that we may not think about, but we want to be sensitive and respectful to.
Absolutely. Dr. Shonda, you're the kind of doctor I love to talk to. I'm feeling warm and bubbly through a computer screen. And I love, I'm so excited for your patients. I wish I was in New York to come be in your office. I love experiences like that and hearing doctors communicate in that way and advocate, for their patients. So again, thank you all for what you do, but thank you for doing that and looking out for women. That's incredible.
To kind of add very quickly something to what Dr. St. John stated, it's also important for us to advocate for ourselves as well. I know a lot of times we go to the doctor, that fear, that mistrust that we've already mentioned, but this is the time that you go in with your pen and your paper, the list of questions you may have, set the tone so that the doctors will come in and give you the answers to the questions you may have. If you also have family or friends who are in the healthcare profession, take advantage of them as well so they can help you navigate the system to ask the right questions or get the proper care that you need. I know a lot of times when we have diagnosis in our community, we become hush about it. You know, we don't want to talk about it, but now is the time to talk. So that we can make sure we get the care we need and the care that we deserve. So I just wanted to really highlight that, not only from the provider perspective, but also it's our chance to be our biggest advocate.
And I just want to just tell a very quick story. I know I love telling stories because people really relate to what's happening, right? And so I had a patient one time and she had an abnormal pap and we had to do a colposcopy and we had to do a biopsy. And so she was like, well, and then I started to talk to her about HPV vaccination. And she goes, no one has ever told me about it, because again, she missed that timing, right? And so she was 34. And so I said, well, we can vaccinate you. And then I said, and she had twin girls who were 12 years old. And I said, well, just like your daughters, they've probably been vaccinated. And she goes, no, I didn't let them get that vaccine. And I said, well, let's talk about that. And again, she came in with questions, right? We went over all her questions. When she came in for her follow-up visit, she came with the twin daughters and she goes, can they get the vaccine too? And I said, well, let's just register them. Let's get everyone vaccinated today. But those are the things we have to, number one, be flexible. We have to be understanding. And I think we have to be creative. And one of the things I'm hoping that we're doing today is giving all of the audience tools that they need to go in there. They need to advocate. They need to be empowered. And don't be fearful, but understanding that fear is normal and that's okay. But you have the bravery because we want to prevent anyone from having an HPV related cancer.
Absolutely. And I know we've talked quite a bit to our audience and to the, our BDO audience, but part of our audience is actually doctors as well. And, as I mentioned, being in a part of a conversation with good doctors, who truly advocate for, women and their patients. I want to ask all of you actually, what steps can be taken to create, that kind of environment, to create a supportive and understanding environment to patients who are dealing with cervical cancer or HPV related diagnosis, considering, it can make you fearful to come back to the doctor. It can, it has a stigma. So what are some things that maybe our doctors can do to make our patients feel safe in that environment?
I can start that answer. I think, and this sounds really very simple, but listening, taking the time and the space to encourage your patients to ask questions. And when they do, answering them to a degree of which they understand. You don't overtalk anyone, and you allow a dialogue to happen because you are partnering with them for their health. And so it changes the dynamic. It changes the who is in charge. It's no longer authoritarian. It's very patient driven. I go to work to make sure that I can partner with my patients to provide the best health for them that is possible. And so leaning into that is crucial, and not just into this is the result of your pap smear or this is what the histology says, but what is the effect of this on your life? What are barriers getting here for this screening? How can we help navigate this? What can we provide? And then if there is an abnormality, this is on an area of the body where you can't see. It's associated with womanhood, and so how you define yourself, and being a mother, being a wife, being a sister. It's things that are not outwardly discussed. And so making that space to have that conversation, sometimes if we lead a conversation on topics or sensitive, sort of taboo-ish, not talked about items, then we take the onus off of our patients because they don't need to start the conversation. We can, and make space for that. And I think that that's really important. That is the joy of my job, to have these conversations. It's more of the social medicine that can be so rewarding and also can allow people to thrive.
If I can chime in, so I always tell my patients, I say, look, think about when you were in elementary school and everyone picked their teams for dodgeball or baseball or softball. Pick your doctor, research them, use avenues like blackdoctor.org, right? Research, right? Because everyone is not a match. Everyone does not have the same style or delivery that would be appeasing to you. So I really encourage them, do your research, go on the internet. There are different types of social media avenues that you can, number one, select your doctor. You want someone who is an active listener, who understands shared decision-making, meaning that I'm not going to tell you what to do. We decide together what's the best fit for you. I think also understanding that there is something called trauma-informed care. There are historical examples of where Black and brown people have had medical mistrust. And sometimes that is the reasoning why they don't want to go in. They don't trust the doctors, right? Or the medical providers. How can we take that in, right? One of the biggest kind of transformative practices that I've been able to do is telemedicine, because we all know that there are time constrictions in terms of how long I can spend with you, right? But if you have those questions down, we can now have another telemedicine visit where you can be in the comfort of your home and we can just talk. And we can make sure that we arrive at the answers that are pleasing and receiving to you. So I think that medicine at this point should be one where it should be patient-centered. The patient is on the pedestal. You decide, am I worthy enough to treat you? Because I went into this to be of service to others. And we want to make sure that you receive the service that you deserve, full of respect, empathy, and compassion, and humility. I think that for a long time, many people, and especially people of color, did not want to go to the doctor. We don't trust what they're saying, right? We know about the Tuskegee experiment. We know about Henrietta Lacks. We know about Fannie Lou Hamer, right? We know what happened with Mississippi appendectomies. And so there is a vulnerability that happens, but also there is the feeling that I don't think I'm going to get the proper treatment. And so I say, research your doctor, select your team, come in with support. You know how many times my patient will be like, well, my mom had this question. I'm like, FaceTime her. Let's see mama. Let's see how everybody's doing. Let's bring them all to the party. Because again, that gives them peace of mind. And so these are creative tools and creative measures, but I feel that our patients are worth it. And so we should go that extra distance and that extra mile because they deserve it.
just to add to, I think what both of you are saying in terms of the doctor creating or setting a tone for how patients should be treated, how we should interact with patients. One of the things that we've learned from HPV vaccination space in pediatric practices is that means from a physician provider perspective that the expectation is that the entire team behaves that way, sets that tone, and we think about it as sort of same way across the entire team. So that's everybody from the person who's checking you in at the front desk to the MA to anyone that you're interfacing with, because that's really the parts of the experience that sometimes are the turn off or, maybe make people feel less welcome. And so we talk about things like, really a same team approach. If the pediatrician is recommending HPV vaccination and a parent says to the medical assistant or the nurse, what do you think? One would hope that that whole conversation happened beforehand as a team to say, this is our stance, this is our approach, because you don't want to sort of undo, what maybe the provider is doing inadvertently by not making sure that everybody is on the same page. And then I just can't let go of, from a research perspective, the power of provider recommendation. And the key that you hold in your hand, that the number one reason that patients choose things is because you said so as a doctor. And so I think, just reinforcing that, that's amazing that you're able to do that. And really, it's such a privilege to be able to influence people kind of on that level, and really taking seriously that your words matter in terms of people's choices.
And to kind of add to that, not just from the perspective of a recommendation, just being able to have that discussion as well when parents still may have questions around the vaccine. We know that a lot of parents sometimes after a recommendation will not go ahead because they still have concerns, or they feel like their questions have not been adequately answered. So, and we know in those visits, times may be short. So we have to be creative and figure out how can we introduce messaging around the vaccine if we don't have the time in clinic. Is it that we have a handout available? Is it that we give pre-visit information? And even some work that I've just completed, we're finding that some parents, even after that first dose, that education may still have to continue, because what if it was a reaction that they perceived linked to the vaccine? We have to be ready to answer those questions, especially if we want them to complete the vaccine series, which we know is very critical to get the most protection. And so I say that to say, overall, we need one message to get out to parents, simply because parents are comparing messages. I hear in my studies, well, my doctor said this, well, my doctor said that. And it creates confusion, hesitancy. And then also we need to have strategies when we can't fully educate in that visit how parents that need that additional information. So we need to start strategizing in those efforts moving forward.
Absolutely. And to our doctors and to our viewers, always feel free to come to blackdoctor.org. We've got content on HPV. We're doing Facebook Lives with the experts, so you can hear it directly from the experts, from the doctors, to give you, the best information, the most accurate and the most relevant information. So feel free to utilize BDO as a resource. Really quickly, we got a couple questions from the audience. Kay said, my friend and I had a discussion on HPV 2 weeks ago about the vaccine. Will they ever have the vaccine for people who are 50 and up? Any thoughts, anyone? Do we know? We don't know yet.
Currently not part of the recommended group. There may be studies ongoing, but currently not part of the recommended group.
Gotcha. And then she also asked, can a person with HPV get the vaccine even if it's dormant to prevent cervical cancer? Yes.
Yes.
Okay. Yes, you can.
Yeah.
And if it's not dormant, is it then too late?
It's never too late. Even I have patients who have abnormal PAPs who I'm doing colposcopies on. There's several recommendations. One is HPV vaccination if they're not already vaccinated, and also smoking cessation. You want them to stop smoking. So these are ways that they can help themselves. And so we want to always advocate that. I just wanted to say about 50 and up, we can be hopeful, right? Because for a long time, it was only up to 26, and now it's up to 45. So I still think that we should be hopeful that it will increase in age as well. But I think that if we proceed, we have to proceed safely. And so we have to have the evidence behind that before we extend the recommendation.
Absolutely. And I actually meant to ask you this earlier when we talked about, I know when it initially came out, I remember when it initially came out, and it had that age stop. And I think you could still get, at some point, you could still get it above the age of 26, but it wasn't covered by your insurance, I believe. So
That's
is
exactly.
it now covered by your insurance all the way up, or is it still not?
So it's covered by your insurance all the way up to 45.
Nice. Okay.
Yeah.
Awesome. Fantastic. Okay. And we had another question from Gabby. How accepting have parents of Black and Brown children been of the HPV vaccine? Dr. Jennifer, what do you think?
So when we look at the rates in terms of initiation, we see that African Americans and Latino children are very much leading in that area, doing very well in terms of initiation. However, when we look at completion, we have some areas where we could improve in terms of uptake. Now, whether that could be from confidence or having concerns, but we also know there can be some logistical issues when you think about coming back, multiple visits. That's why when we go back to a comment we heard earlier, the earlier we get the vaccine, you have two doses versus 3, which could really help in that area. And we would say and highlight that there are studies being done for a 1-dose vaccine. So we're following that as researchers. But yes, so in terms of the vaccine, we're doing well. We just have to make sure we get our children back in to complete that dose and follow up with parents, figure out what's going on, send out reminders to make sure parents are aware that the vaccine is due. Constantly, I hear in my studies, I didn't even remember I was supposed to come back, or I didn't know I had a second dose. The doctor did not communicate that to me. I didn't know I had a third dose. So it's very critical to keep that open communication with parents about the vaccine. And then in terms of the rest, just very much being diligent, constantly educating. We know a lot of times we hear that parents just aren't aware about HPV and the vaccine. Many times we're hearing our parents are not getting a recommendation around this vaccine. So it's so critical that we continue to advocate, give a recommendation so that they can make an informed decision.
Absolutely. And we have another question from Gabby. Do you have to pay for your cervical cancer screening? And what if you don't have insurance?
Mm-hmm. I think that's a great question. I think that there are many places. I know in New York, there are many free cervical cancer screening locations. Sometimes you can simply Google and you'll find, but there are many opportunities to get free cancer screenings. We also, during the month of January, we have a mobile unit that goes throughout the state and we provide free cancer screenings. And so I think that with a little bit of research, we can make sure that we can, find out those locations to have free cervical cancer screenings. I just wanted to just put in a quick kind of pearl that I use with my young ones is everyone has an iPhone or a smartphone or a smart device, and it's glued to the hand. Sometimes it's ringing while I'm seeing the patients. So I have them put a reminder in. Mm-hmm. In 2 months, you need the next dose. In 4 months from that, you need the next dose. And, that is very well received. They love, the technology. And I think we have to move towards that. And one of the biggest challenges I face is, misinformation or having, Dr. Google, Dr. TikTok, and Dr. Instagram, And so that's why I lead with the evidence, information, and, they used to love handouts, but that's not kind of the thing anymore. But we have to also talk about what we can do to adapt, right? To what is the nuance now. I'm of the age when there was no electronic medical and we wrote hand notes. That's not the time anymore. But I think you can be creative and make sure that it's time appropriate, age appropriate. But also, I think we have a lot of savvy young adults and they want to do the right thing, and so sometimes they're just really craving that information and we want to provide it for them.
Yeah. I can chime in. I know I'm plugging BDO, but if the handouts aren't working, the resource, like you said, the phone is right there. BDO is compatible on desktop and your mobile. But yeah, feel free to screenshot our site, bookmark things. We have the information there for you. You can learn how to advocate for yourself in the doctor's office. So you don't have to, go in and not know or not know how to be an active participant in your health. So unfortunately, I've loved this conversation, but unfortunately, we are winding down on our time. Ladies, I want to thank you so much for joining me today. I want to ask if you have any final thoughts, anything you'd like to share with the BDO community. We'll start with Dr. Amy. Any final thoughts on our discussion today?
I think we need to have more discussions like this universally to make sure that folks are educated about the choices that are available to them, the vaccination, cervical cancer screening, be able to answer any questions that may have, and also make sure that they get proper care.
Dr. Susan, what do you think?
Something that keeps me up at night and keeps me energized is that we have an opportunity to prevent cervical cancer in our lifetime or eliminate for the vast majority of individuals this cancer with the tools we have today. We don't need to invent anything more. Screening, vaccination, and follow-up of abnormal results. If we can master those three things in partnership with patients and providers, we're actually on our way to making a cancer a history.
Dr. Jennifer.
From the vaccination perspective, engage in shared decision-making with parents, be a partner with them. And in some cases, that's a package with the child, depending on the parent. And always have the information that they need in order to make an informed decision. And even if they say no, be empathetic. Show cultural humility and allow them that space. And as they keep coming back, just be a reminder to say, hey, you need the vaccine.
Absolutely. And Dr. Ashanda.
Well, I just want to thank you for this opportunity to really engage with people on your platform and just having all that information. I am hopeful that I never have to diagnose a cervical cancer again in my career, because that is what kind of grounds me in doing this work, in making sure I have time available to talk to people and have them understand. It is the difficult thing that I went into OBGYN because I thought everything was going to be happy and joyous and delivering babies. And, when you have these very difficult conversations, right, it brings the reality and the humanity back into medicine. So I am hopeful that this will help encourage people to get vaccinations. And I'm hopeful we will reach the goal as part of the HPV roundtable that we will eradicate cervical cancer and HPV related cancers, because this should not be happening, not in 2025, not at all.
Absolutely. Well, once again, ladies, thank you so much for joining me this evening. Audience, BDO community, thank you again for tuning in. This has been such an enlightening conversation. I know I'm going to come back and take notes, so I hope you had your pen and paper out because they dropped some gems. So hopefully we will see you all soon. Ladies, I would love for you to come back and have another conversation with us on this topic. And BDO family, I hope you can join us for the next conversation. Have a good night.